Hey guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're going to be doing another Kahoot, but this Kahoot is specifically made for my NP students. If you are in the NP program right now, or you've graduated and you're studying to take your NP certification exam, this Kahoot is for you. And I promise there are more coming down the pipeline. So, if you know anyone that wants to be an NP or studying to be an NP, please go ahead and share this video with them. Now, before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it. Go ahead and give it a thumbs up now so you don't forget. Subscribe to my channel if you haven't done so already. And be sure to check out my website, nexusnursinginstitute.com. I've got some exciting things coming down the pipeline very shortly. I will be introducing my Nexus Nursing NCLEX test bank where you guys can go over. Guys, I do not have the answers to NCLEX. I'm telling you that right now. However, I do have content that's been seen on NCLEX over and over and over and over again, and it doesn't matter which state you're testing for. This is important information that you need to know. So I have NCLEX type of questions with NCLEX types of concepts that you absolutely need to know. That's coming down the pipeline very shortly. But right now, you go to my website, you can sign up for Next Generation NCLEX Review Session, Part 1 and Part 2. Part 1, I teach you how to think critically. I teach you about prioritization and delegation, different words and phrases that NCLEX uses and where your mind is supposed to go. I teach about different situations that NCLEX may present before you and what NCLEX is trying to pull out of you. In part 2, we go over NCLEX type of questions and most importantly, the rationales and how you need to be able to apply them to the type of questions that you get. Also on my website, you can sign up for a consultation session. Maybe you want to pick my brain about something. You want advice about something that has to do with the nursing arena. Maybe you'd like a private one-on-one tutoring session with me. Yes. I mean, I book very quickly, but still, you can sign up for a private tutoring session with me. If you're currently in the program and you are struggling, you got to do really well on your next exam, like well enough that you don't get kicked out of the program. Check out the audio lessons that I have available. Thank me later. All of those can be found on my website, nexusnursinginstitute.com. Now, my Nexus Nursing Test Bank, I haven't rolled it out yet. I'll make the big announcement, when it's there, but I'm just letting you know that is coming down the pipeline. So be sure to watch out for that. And I've been getting so much feedback from the NP students saying, Professor D, you always forget about us. And so I promised I was going to take proactive measures to produce more content for you guys, and more is coming, I promise. Almost daily, you guys can find me covering a variety of nursing topics across my social media platforms, such as TikTok, Instagram, Facebook, YouTube. My handle is the same everywhere, Nexus Nursing, so be sure to check me out. Without any further ado, guys, let's get started. Health promotion and disease prevention for the nurse practitioner student. First question. Select all that apply. Which population is at highest risk for developing serious flu-related complications? Which population is at greatest or highest risk for developing serious flu-related complications? Here are your options. Children 6 months to 59 months, adults 50 and older, anyone with a chronic pulmonary disorder, anyone with a chronic cardiovascular disorder, anyone that is immunocompromised, women who are or will be pregnant during the flu season. Those are your options. Select all that apply. Who is at highest risk for developing serious flu-related complications? If you were not able to join the Kahoot, you can still participate. Just type in your answer on the live. Lex said, I'm doing you guys dirty right out the gate. Guys, these are the type of questions you're going to see on that test. You got to know this. All right. All of them. And I didn't have enough room, so there's one more. I'm going to talk to you guys about it. So let's go through these options first, and I'll talk to you about the one that's missing. Any child that's 6 months, because that's the earliest they can get it, 6 months to 59 months, adults 50 and older. Just think about it. The very, very, very young or very, very, very old, they're going to be at risk for complications from the flu. Anyone with a chronic pulmonary disorder, I'm talking about asthma, emphysema, bronchitis, anyone with a chronic cardiovascular disease, any type of heart disease, anyone immunocompromised, HIV, AIDS, cancer patients that are getting chemotherapy, right? Patients with autoimmune disorders, they all fall under that category. So sometimes exam may not be straightforward and say, oh, the person's immunocompromised, but they'll give you a patient that has myasthenia gravis, or they'll give you a patient that has lupus, or they'll give you a patient that has HIV or AIDS. You need to recognize that they're immunocompromised. Therefore, they're going to be at risk for having serious complications from influenza. Women who are pregnant or will be pregnant during flu season, they're going to be at risk for complications. Now, one more thing you do have to know, because this has been seen on the exam as well. You have children who are, 6 months old to 18 years old. If they are getting aspirin, um, or they're getting salicylate containing drugs. Let's say, patients got something like Kawasaki. We don't give aspirin to children except for certain conditions, right? One of them being Kawasaki. Maybe they've got Kawasaki. Maybe there's something else going on with them that they have to get a salicylate containing drug or aspirin. They are going to be at very high risk for developing flu-related complications. Why? Guys, matter of fact, tell me on the live. Why? What is what I can't speak. What is the name of the disorder that they can get? Thank you, Ray syndrome. That's why. Perfect. Perfect. Very good. Next question. All right. ACIP recommends all children to be vaccinated against hepatitis A virus starting at blank year of age. What age is it? Is it 1, 2, 3, 4, 5, or 6? ACIP recommends all children to be vaccinated against hepatitis A virus starting at what year of age? Very good one. One is a huge milestone. That's where they get the most vaccinations in one visit. That's when they go from, the bottle to the sippy cup. That's when they go from, formula to whole milk. Huge milestone, 1 year old. Now, something else that you may get a question on that you need to know who's at highest risk for hepatitis A. Okay, so you need to know it's going to be, of course, your healthcare workers, your daycare workers, those that handle food, those that handle animals, those that work in sanitation, those that are in the military. Right? You need to know who are high risk for contracting hepatitis A. Make sure you know those. All right. IPV, MMR, varicella vaccine. These are contraindicated in the patient that has had an anaphylactic reaction history to what? Would it be neomycin? Would it be Baker's yeast? Would it be gelatin? Or would it be antiviral agents? Again, the IPV, the MMR, the varicella vaccine, these 3 vaccines will be contraindicated in a patient that has had an anaphylactic reaction history to what? Neomycin, Baker's yeast, gelatin, or antiviral agents. You need to know this. Neomycin. Neomycin. Yup. If that patient has had an anaphylactic reaction, and guys, when I say anaphylactic reaction, I'm not talking about, oh, a rash on the face or a rash on the belly button. I'm talking about hives. Okay. I'm talking about angioedema. I'm talking about airway obstruction. I'm talking about change in level of consciousness. I'm talking about hospitalization. That's what I mean when I say anaphylactic reaction history. Okay. Another question you may get on your NP certification exam They'll give you a situation where you're about to administer a medication or you're about to order a medication for a patient, and they say to you that they're allergic to that drug or they're allergic to that vaccine you're about to order. What is your next step? Every single day of the week, your answer is going to be to ask them, what was the allergy? What was the reaction? Why are you asking them that question? We need to know, okay, did they have a true allergy or did they have a side effect? Remember, guys, side effects are things that we know can possibly happen. It's not going to stop us from ordering that drug, right? We just warn them that it may happen, but it's not going to change. An adverse reaction, such as anaphylactic reaction, that we do need to know. If we know that they have a history, we're not going to order that medication or that drug. So there's a big difference. So whenever they say, oh, I'm allergic, your first reaction, first question out of your mouth better be, what was your reaction? Because you have to be able to differentiate the two. How are you guys doing on the live? Reese, thank you for sharing the live. Thank you. Next question. All right. Hepatitis B vaccine is contraindicated in the patient that has had an anaphylactic reaction history to what? Penicillin, Baker's yeast, gelatin, or neomycin. So now we're talking about the Hep B vaccine. We are not going to order this vaccine. We're not going to give it if the patient has an anaphylactic reaction history to what? Penicillin, Baker's yeast, gelatin, or neomycin. Wow. Most of you guys with penicillin, nope. Baker's yeast. I hope the 49 of you that chose penicillin, you're not the NP students. You guys better know the stuff. I'm not playing. Let's keep going. True or false? Older children and adults with no history of varicella infection or immunization against it should get 2 varicella shots 4 to 8 weeks apart. Is this true or is this false? So when we're talking about older children and adults who's never had a history of varicella infection and they've never been immunized, they've never gotten a shot against it, they should get 2 varicella shots 4 to 8 weeks apart. Is this true or is this false? Come on, guys. There's over 150 people on this Kahoot. I need more people to answer. It's true. It's true. Now, guys, routinely, the way it's supposed to go on that child's first birthday or like immediately after that first birthday, they're going to get the shot and then they'll get the next dose around 4 to 6 years old. That's how it's supposed to go. But if for some reason they've never had varicella and they've never had the infection, they've never been vaccinated against it, if it's an older child and adult, they're going to get 2 4 weeks apart. But you also have to know what the routine is, okay? First birthday or immediately after, and then that second dose between 4 to 6 years old. You have to know both of these. All right, which vaccine is indicated for those 2 months to 6 years of age? And we're talking about the tetanus, diphtheria, and pertussis vaccine, okay? Which one is indicated for those who are 2 months to 6 years of age? Now, you see how these letters are so close to each other? Guess what? There's a big difference. You have to know the difference. Is it DTaP, Tdap, TD, or TDP? You can't use them interchangeably. They are not the same. All right, guys, 2 months to 6 years of age is going to be your DTaP, capital D, capital T, small a, capital P. That is the one for the pediatric patients that are 2 months to 6 years of age. Okay? All right, let's do the next one. How about the children who are 7 years or older? We're still talking about the tetanus, diphtheria, and pertussis. Is it going to be capital D, capital T, small a, capital P? Is it going to be your Tdap, capital T, small dap? Is it going to be your TD, capital T, small d? Or is it going to be your PPD? You got to know the difference. All right. Very good. 7 years or older, capital T, Tdap. Very, very good. Now, for the two of you that chose PPD, stop it. Stop it. PPD has nothing to do with this vaccine, okay? PPD has to do with a screening test for meningitis. That's a skin test. Stop playing. Moving on. I made that up just to see. All right. Which vaccine is used as a booster dose every 10 years? Again, we're talking about the tetanus, diphtheria, and pertussis. Why do I keep talking about this vaccine? Because it shows up a lot on the NP certification exam. All right. So which one is the booster? Is it the PPD? Is it the PPE? Is it the Tdap? Or is it the TD? Now, by process of elimination, you guys should all get this right. Come on. How do you want to choose Tdap when I told you, I just told you that capital T, Tdap was for the 7 years or older. Are you serious right now? Okay, guys. So that booster every 10 years, it's going to be the TD. I'm happy only one person chose PPE. PPE is personal protective equipment. That's like your gown, your gloves, your mask, all that good stuff, okay? So yeah, the booster every 10 years, that's your TD. You guys need to know the difference. Moving on. Select all that applies. What are the 5 A's of tobacco cessation intervention? Select all that apply. Here are your options. Ask, adhere, advise, assess, assist, arrange. Which are the 5 A's? What do you guys think? The 5 A's of tobacco cessation. Ask, adhere, advise, assess, assist, arrange. Okay, let's talk about this. So it's ask, advise, assess, assist, and arrange. So you are going to ask that patient about their tobacco use. The first thing you do is get information. Ask them about the tobacco use. Then you're going to advise them to quit if they do use tobacco. Then you're going to assess their willingness to even try. Then you're going to assist them to try. And that will include prescribing an FDA approved drug to help them to quit smoking. And last, you're going to arrange for a follow-up visit. Why? We got to keep track of this patient, keep encouraging them. We got to get them to stop smoking. Ask, advise, assess, assist, and arrange. Now, the way you may get this question, it may not be a select all that applies like this. It may be asking about the 5 A's, but they may be using one of them, such as advise or assess, and they'll give you an example of what you'd be doing. Okay, so make sure you know these well. An example of primary prevention for a 74-year-old patient with COPD would include reviewing and explaining their drug list, performing an assessment of their home to minimize their fall risk, comparing their FEV1 to their FVC, or ordering a fecal occult blood test. Which one would be a type of primary prevention? Very good. Performing an assessment of home to minimize fall risk. Risk meaning it didn't happen yet. We want to prevent it from happening. They're going to kill you with prevention questions. You have to, and this is on both certification exams, you have to know the difference between primary, secondary, and tertiary prevention, okay? Primary prevention, patient doesn't have it. We want to make sure it doesn't happen. So we're going to do education. We're going to give vaccines. We're going to assess for risk to make sure it does not happen. That is primary prevention. Secondary prevention, we think they have it, they may possibly have it, and we want to test to see how bad it is. That would be something like a biopsy, a colonoscopy, oh my gosh, what's it called when you check the breast? Look at me patting my breast. Oh my gosh, what's it called, guys? Mammography, thank you. Mammography. That would be a type of secondary prevention measure, right? And then you have tertiary preventative measures. Tertiary, they already have it. We just want to keep it from getting worse. So tertiary would be something like physical therapy, occupational therapy, speech therapy. They already have it. We just want to prevent it from getting worse. So make sure you guys know the difference. So in this case, the patient with COPD, doing that home assessment, we want to prevent them from having a fall. They haven't had a fall yet. We just want to make sure it doesn't happen. So that is primary. Now let's look at the other subjects. Let's look at the other options. The first one, reviewing and explaining drug lists to a patient. If the patient is prescribed a drug, it's for a reason. That means they already have it. We just want to prevent it from getting worse. So that's what? A tertiary preventative measure. How about comparing the FEV1 to FVC? By the way, guys, I'm telling you right now, when it comes to bronchitis, emphysema, asthma, they kill you on questions on those. You better know what these are. Okay, you better know these parameters. FEV, that is your, I'm telling you, you better know, and I can't remember. Something expiratory volume. What does the F stand for? Forced, yes. Forced expiratory volume. And your FVC is forced vital capacity. You got to know the difference between those two. But anyway, if you're comparing those two, this patient has COPD, they already have it. We're comparing it to see, has it gotten better? It's gotten worse. We don't want it to get any worse, right? So that could not be considered a primary prevention because remember, primary, they don't have it yet. And then last, ordering a fecal occult blood test, that would be what? A secondary preventative measure. Make sure you guys know the difference. All right, which would be an example of primary prevention in an 82-year-old female with osteoporosis? Here are your options. Ordering bisphosphonate therapy, ordering calcium supplements, ensuring adequate lighting in the home, or ordering the use of a back brace. Which one would be considered primary prevention? Nobody better get this wrong. Thank you. Very good. Ensuring adequate lighting in the home because we want to prevent falls. Ordering bisphosphonate therapy, that would be a treatment for the disease that they already have, which is osteoporosis. That would be what? Tertiary. Ordering calcium supplements, that's for the patient that already has osteoporosis. We just don't want it to get worse. Tertiary. Ordering a back brace for the patient that already has porous bones. We just don't want it to get worse. We want to help them. That would be what? Tertiary. So the only one here that's primary would be adequate lighting. We want to prevent a fall. Last question. Which is the most cost-effective form of healthcare? Is it primary prevention? Is it secondary prevention? Is it tertiary prevention? Or is it cancer reduction measures? And guys, the answer is not only the most cost-effective form of healthcare, it is the most preferred form of healthcare. Jenny, I'm going to fight you. You better change your answer right now. Primary prevention. Primary prevention, preventing something from happening is the cheapest and most effective measure to help somebody. Why wait until they get a disease to treat the disease with a whole bunch of diagnostic, well, treating not diagnostic tests, but with a whole bunch of medications or surgeries when we could have prevented it from happening, right? Primary prevention, that is the most cost effective and most effective. Let's get it before it even happens. That's right. Education is free. I love that. Very good. Okay, guys. Anyway, this is it for the health promotion and disease prevention portion. I've got lots more Kahoots and teaching coming out for the nurse practitioner students. So if you know anybody that wants to be a nurse practitioner that's studying, please share this with them and let them know more is coming to subscribe to my YouTube channel. Let's see how you guys did.